Welcome back. You're still watching The Globe. Now, more than 35 million people around the world now suffer from drug addiction. This is according to the latest annual report from the United Nations Office on Drugs and Crime released last month. The office was today part of a webinar looking at how cities have responded to drug use and HIV in the context of COVID-19. For more on this, I'm now joined via Zoom from Latvia in Europe by Southern African Health Advisor for the United Nations on Drugs and Crime, Signe Rotberga. Thanks so much indeed for joining us, and welcome to the program.
Good evening. Thanks for having me.
How alarming are the statistics that have come through about the prevalence of drug addiction and its rise?
Well, you mentioned the webinars that we were having today. The main purpose was to share experience between the cities of South Africa on how they responded to the challenges posed by COVID to people who are using drugs, and also to inform about recent policy developments. International guidelines are very clear that drug treatment services and harm reduction services are essential and should be available during the COVID restrictions. And the discussions today shows that there are very many good initiatives that have taken place during the lockdown time. The services were arranged very quickly in challenging circumstances. As you know, in South Africa, many people who use drugs are homeless and were taken to the makeshift shelters. So it was not easy within a short period of time to ensure that those who need help receive the assistance with withdrawal symptoms. Those who were on methadone treatment are able to receive their medication and all the other support that is needed. And another good development that I would like to share from the webinar today is that there is more and more funding allocated for these services from the national budget. Until now, there was a lot of programs funded by charities or external donors. Today, we heard that, for example, city of Tshwane has allocated funding for harm reduction programs in their city. So these are very, very positive developments.
How is South Africa doing when compared perhaps to other countries in the region?
Well, if we speak about the region of Southern Africa, there are no other countries who have so well-developed programs for people who are using drugs. So the others are looking and learning from South Africa. If you look a little bit further, and for example, the Eastern Africa, where similar problems with drug use are present, and many services have been developed. These countries have also solved a lot of challenges, mostly related to interruptions in supply of medication, increase in domestic violence, the same as here, and then how to make sure that women who are using drugs, who are very stigmatized, how they get the support that is needed in cases of gender-based violence. And there are also innovations that COVID pandemic has forced us to do. For example, in Eastern Africa region, methadone therapy is available in prisons, and due to restrictions, there were arrangements made to deliver more effectively these programs without engaging many people from outside the prison.
All right, so far we've been talking a lot about people that were in treatment and perhaps being supported by various programs, but there are many, many more people that are drug addicted and have not been getting any kind of help. How has COVID-19 made their situation worse?
As I said, those people who were taken, who are homeless and who were taken to these makeshift shelters, there is a different experience, as we heard today. There are good examples when the support for these people who are using drugs and need medical assistance was provided. And there are other examples where they were left without attention and where they experienced harassment and unnecessary use of force by the police. So the important thing is to make sure that these services are accessible, and we can't blame for people for not coming to the services. We have
Right.
to create the services that they are attractive and that they meet the needs of those for whom they are designed.
What can families do in the interim? We've got this lockdown. As you said, some facilities and services and support programs are just not available. So you have an addict in the house. What can one do at home, perhaps as a stopgap until these facilities become available?
Well, in general, treatment services are available, and in case there is a need for a professional help, then that should be sought. But what I would like to say, it is important that there are all kinds of services offered, but not all of them are evidence-based. So it is important to do a little bit of background information collection and learning on what works and what doesn't work. There is so much evidence accumulated about addiction, about people who use drugs, how to help them. So it would be important to use those which are really scientifically based and human rights based.
All right, perhaps in conclusion, and I think you've partly answered this question, but what would you say then were the most important conclusions that you were able to draw today from the webinar?
I think there are very several positive developments. If you look at the national policy, the new National Drug Master Plan has been adopted. And the master plan is based on the principles of human rights, on what I just said about following scientifically based interventions, patient-centered. So there is now this national framework that is guiding the prevention and treatment programs and harm reduction. The Department of Health reported that they are in a process of developing guidelines for opioid substitution therapy. So this is also a very important step because this was missing, and together with the guideline, there is also a national plan for implementation of opioid substitution therapy. So there are good things, and the remaining challenge with regards to treatment, pharmacological treatment, is the very high price of methadone in South Africa. It is approximately 10 times higher than in other countries. So this is the issues that needs urgent solution in order to make the treatment available to much more people than it is now.